today we will be learning about embolization, specifically our main topic to be discussed, which is uterine artery embolization. But first, we need to know what is embolization. So embolization, it refers to the passage and lodging of an embolus within the bloodstream. It is a delivery of clotting agents such as coils, plastic particles, gel foam, directly to an area that is bleeding or to block blood flow to a problem area such as aneurysm or a fibroid tumor in the uterus. So in other words, embolization is deliberately blocking a blood vessel. Embolization is also used to treat a wide variety of conditions affecting different organs of the body. So now that we already know what is the meaning of embolization, we will now proceed to our main topic, which is uterine artery embolization. So what is uterine artery embolization? It is a procedure in which an interventional radiologist uses a catheter to deliver small particles that block the blood supply to the uterine body. It is a procedure to treat fibroids without surgery, as uterine fibroids can cause severe symptoms in some women, including heavy menstrual bleeding, pelvic pain, and swelling of the abdomen. So with the use of uterine artery embolization, it destroys fibroid tissue and eases those symptoms. And it also provides an alternative to surgery to remove those fibroids which is in the uterus. And if you are one of those women who experienced those symptoms mentioned a while ago, you might choose uterine artery embolization. Is first, if you are premenopausal. Second, if you have severe pain or heavy bleeding from uterine fibroids. Third is if you want to avoid surgery or surgery is too risky for you. Fourth is if you want to keep your uterus. And lastly, optimizing a future pregnancy isn't your chief concern. As a woman, we really cannot stand severe pain. So if you decided to undergo uterine artery embolization, your physician will discuss to you the clinical indications, contraindications, how it is performed, the preparation that you need before the procedure, the risk and precautions, and also the aftercare after you undergo that procedure. So now we will proceed to the clinical indications of uterine artery embolization.
Fibroids, menorrhagia, pelvic pain, pre-OP measure for large fibroids. Number 2, postpartum hemorrhage, deliver of childbirth. Number 3, dysfunctional uterine bleeding, regular uterine bleeding that occurs in the large abscess of recognizable pelvic pathology, general medical disease or pregnancy. Number 4, adenomyosis, condition in which the inner lining of the uterus breaks through the muscle wall of the uterus. Number 5, uterine artery aneurysm. Number 6, uterine artery venous malformation, defined as abnormal and non-functional connection between the uterine artery and vein. Contraindication: visible pregnancy, suspected pregnancy of the uterus or ovary. Number 3, contrast allergy, renal impairment. Number 5, refusal to accept the hysterectomy under any circumstance.
Uterine artery embolization preparation. Before the procedure, the patient will have appointments for an MRI of their uterus, and ultrasound of their uterus. MRI or ultrasound will provide images of the interior structure of the uterus, helping to determine the source of symptoms. Before their surgery, their surgeon will require them to have a comprehensive physical examination within 30 days of their scheduled surgery date. The history should include information about the condition for which the surgery is planned, any past surgical procedure, and the patient's experience with anesthesia. Blood tests are frequently drawn within 14 days before surgery. This is done for a number of reasons: to examine their general state of health, to determine if any signs of infection are present. So, blood work needed includes BUN, which means blood urea nitrogen, a common blood test. The blood urea nitrogen test reveals important information about how well their kidneys and liver are working. Second is the creatinine. The third is platelet. Fourth is hemoglobin. And the fifth is potassium blood test. And the last is the INR, or the International Normalized Ratio test. It means measures the time for your blood to clot. So after the patients do their appointments, they must inform their doctor of any prescriptions or over-the-counter and herbal medications that they are taking, including aspirin or blood thinning product. If the patient had a heart attack or stroke, their doctor will likely recommend them to take a daily aspirin unless they have a serious allergy or history of bleeding. So there are two types of blood thinners: anticoagulants such as heparin or warfarin slow down their body process of making clots. When you take a blood thinner, they must follow directions carefully. They will probably need regular blood tests to check how well their blood is clotting. Do not eat or drink anything for 6 hours and drink extra fluid for 2 days prior to their procedure. So every operation is different. Whether they allowed to eat or drink beforehand and what you can have will depend on the type of operation and anesthetic the patient. There are two types of anesthetic. First is the local anesthetic, which means numbs the area that the patient do not feel any pain. The second is general anesthetic. It makes patient unconscious, so the patient cannot feel anything of what's going on during the operation. Usually, before having a general anesthetic, they will not be allowed anything to eat or drink. This is because when their anesthetic is used, their body's reflexes are temporarily closed. If their stomach has food and drink in it, there's a risk of vomiting or bring up food into their throat. So, the amount of time they can have to go without food or drink before they have their operation will depend on the type of operation they are having. However, it is usually at least 6 hours for food and 2 hours for fluids. And if they are taking a local anesthetic, they should be allowed to eat and drink as normal before their procedure. If the patient have allergy to contrast dye, they need to inform her or his doctor, because contrast materials carry any slight risk of causing an allergic reaction For example, the patient have history of asthma and high fever, history of heart disease, diabetes, or kidney disease, and allergies to contrast materials, food, drugs, dyes, and preservatives. So, on the day of the procedure, first is remove all jewelry from the patient's body like watch, earrings, necklace, or rings, or any metallic objects so that to ensure that there is no artifact during the scanning. The second is don't have anything to eat or drink after midnight on the day of their procedure. Only take a sip of water. Wear loose so that the patient is comfortable. Bring the health card of the patient and please shower the patient using antiseptic cleanser. Come to the hospital before 2 hours of their procedure because the staff will prepare the patient's surgery. They will ask the patient to change into a gown, to wear a cap, and to wear a paper slippers. Put an ID bracelet around the patient's wrist. Ask the patient to state their name or the birthday. Check the blood of the pressure of the patients, the heart rate, and the breathing rate. And patients who are already in hospital, the night before an operation are usually given medicine to help them sleep or sedative to reduce anxiety. Like benzodiazepines are often used for this purpose. Sedatives are also given before the operation, usually in the last 2 hours before the anesthetic given. Before their surgery, no smoking for 72 hours for the risk of serious complications and help to recover more quickly. The patient not allowed to drive for 24 to 48 hours, and if the patient are staying at the hospitals, they will be transferred to a hospital room and the nurses will check the vital signs of the patient, give any other medicines they need, and a nurse places an IV line into their arms so the doctor can give the fluid and medicine.
The risks and precautions of the procedure. There are some risks of the procedure, but they are very rare, and some of the risks include bleeding at the puncture site or cut. This is very rare. If it happens, go to the nearest emergency department, and while you wait for help, put a clean cloth over your site and apply pressure. This will help slow any bleeding. Allergy to X-ray dye used. Other arteries becoming blocked. This can damage other organs or tissues. Death of the uterus. The pain in your pelvis will continue longer than usual. You would need a hysterectomy, which is uterus would be removed. Abscess or infection in the uterus. A degenerating fibroid can provide a site for bacterial growth and lead to infection of the uterus or endomyometritis. Many uterine infections can be treated with antibiotics, but in extreme cases, infection may require a hysterectomy. Early menopause. Talk to your doctor for more information about the benefits and risks of this procedure. Pelvic pain or fever that doesn't go away. Pain and fever for less than 38 degrees Celsius are common for 3 to 5 days after the procedure. Vaginal discharge that is thick or smells bad. This may mean you may have an infection or problem with fibroid passing through. You may need to see a gynecologist. Damage to other organs. unintended embolization of another organ or tissue can occur, although it's not as high risk as with surgery. Whether you have embolization or surgery, disruption of the ovarian blood supply is possibility because the ovaries and uterus share the same blood vessels. If you're nearing menopause or you're in a premenopausal stage, such a disruption could lead to menopause, but that's rare if you're age 40 or younger. Possible problems in future pregnancies. Many women have healthy pregnancies after having uterine artery embolization. However, some evidence suggests pregnancy complications, including abnormalities of the placenta attaching to the uterus, may be increased after the procedure. If you want to have children, talk to your doctor about the risks of the surgery and how the uterine artery embolization might affect your fertility and future pregnancy. The reasons to avoid this procedure: avoid uterine artery embolization if you are pregnant, if you have possible pelvic cancer, if you are an active or recent chronic pelvic infection, if you have condition that affects your blood vessels, and if you are allergic to contrast material containing iodine.
Aftercare. I will give you a general idea how long it will take for you to recover, but each person recovers at a different pace. So follow the procedures and steps that I will be discussing to get better as quickly as possible. So you can expect to feel better each day, although you may get tired quickly and need pain medicine for several days. You need about 7 to 10 days to fully recover. So after the procedure, how can you take care of yourself at home? First is you need to rest when you feel tired. Getting enough sleep will help you recover. Try to walk each day. Start out by walking a little more than what you did the day before. Bit by bit, increase the amount you walk. Walking boosts your blood flow and helps prevent pneumonia and constipation. So for 1 week, avoid lifting anything that would make you strain. An example for this is a child carrying heavy grocery bags, milk containers, a heavy backpack, or a vacuum cleaner. So you need to avoid those strenuous activities such as jogging, weightlifting, aerobic exercises, but it's just for 4 weeks. You may also shower after 24 hours after the procedure. So you need to gently wash the catheter insertion site with soap and water, but do not scrub. Do not bath or soak in water for 5 days following the procedure. So now we will talk about the diet. So after the procedure, you can eat your normal diet, but if your stomach is upset, you need to try bland, low-fat foods like plain rice, broiled chicken, yogurt, or toast. So you need to also drink plenty of fluids unless your doctor tells you not to. So with the medicines, your doctor will tell you if and when you can restart your medicines. He or she will give you instructions about taking any new medicines. So if you are a patient who is taking aspirin or any blood thinner, ask your doctor if and when you can start taking it again. So make sure that you understand exactly what the doctor wants you to do. So take pain medicine exactly as directed. So if the doctor gave you a prescription medicine for pain, take it as prescribed. If your doctor prescribed antibiotics, take them as directed. Do not stop taking them just because you feel better. You need to take the full course of antibiotics. This will also help you to get better, to get fully recover quickly. So you need to follow what the doctor tells you to do. You need to follow the instructions carefully. It is also for your own good. Another tip that I can give you is you need to wear loose comfortable clothing, and avoid anything that puts pressure on your belly. You may want to use a heating pad on your belly to help with the pain. Girls, follow-up care is the key part of your treatment and safety. So be sure to make calls and go to all appointments and call your doctor or nurse if you are having a problem. Guys, this is it for today. I do hope that you learned a lot from our discussion. And if you decided to undergo uterine artery embolization, talk with your attending physician so that he or she could help you prepare yourself mentally and physically and what is the best thing for you to do. Thank you for watching. Have a good day and take care.